My name is Lisa Simmons. I'm one of the physicians at Hematology Oncology Associates of Fredericksburg. I've been working here for about 7.5 years now. When I finished high school, I knew that I wanted to go to medical school, and so I took a job as a nursing assistant at a hospital in my hometown. And I was assigned to the oncology floor, as fate would have it. Despite really serious medical problems, these patients seemed to be jovial and always interested in what was going on in my life, and I was just a 19-year-old kid. So they really made an impression on me. And I also just really enjoyed seeing the physicians rounding, writing out their chemotherapy orders. It was very attractive to me as a mathematically minded person. One of the other things that I remember about that time was when a new drug called Taxol was approved by the FDA and the excitement on the unit. When we began to give that drug to our patients with ovarian cancer, it was just very memorable for me. And then when I went to medical school, I really just was fascinated by how cancer grows in the body and how it is able to disseminate. At that point, it was clear that medical oncology was where I needed to be, and it's been the best decision for my life. My favorite part of the day is when I get to meet a new patient. I enjoy getting to know them as a person rather than only in relation to their disease. And this is my time to make them feel comfortable and informed. And I'm really proud of where I work, and so I'm proud to represent the people that are here and be the face of our team during that initial patient visit. I'm part of a team that gives all of the tools that another human being needs to take the best care of themselves they can. But my best success story is actually my own grandmother. She had a metastatic recurrence of her ovarian cancer. It was all in her lungs, and she had a complete remission, particularly due to Taxol. Every time I think about her, I think about her trusted oncologists and nurses and medical assistants and lab technicians and everybody at the NIH and all of the unnamed people in all the important roles helped to bring that drug to approval just a few years before she needed it. She died last year at age 99, but we had 27 more years with her after her diagnosis. And the fact that this may happen every year for families, every time there's a new drug approval, that's what keeps me moving. My husband and I have 4 children from the ages of 8 to 17. And being their mother has been the delight of my life. Managing my family brings me a lot of joy. In those moments when I do have an extra hour, I would love to read pretty much any nonfiction book. I'll also take hikes, and I have attempted a small vegetable garden a few years, and we'll probably do so again this year. The best part about this office is the people that work here. I could see that the first day I interviewed, and it's continued to be true, and it makes me proud to work here every day.